Have you ever watched your child sleeping or playing and wondered if that little sniffle or cough was something more? It is completely normal to worry about their well-being, especially when it comes to something as vital as breathing. Recognizing breathing struggle in a child involves carefully observing specific visible signs, listening closely for unusual sounds, and trusting your parental instincts. These indicators are your child's way of telling you they need help, and knowing them can make all the difference in getting them the right care quickly. The core reason these signs appear is that your child's body is working harder than usual to get enough oxygen. When airways narrow or lungs become inflamed, the muscles involved in breathing have to exert extra effort. This increased effort manifests in the visible changes you observe, which are direct signals that oxygen intake might be compromised. To accurately identify a breathing struggle, you will want to look for several key visual cues. First, observe their breathing rate. If it is much faster or slower than normal for their age, that is a red flag. Second, check for retractions, which are when the skin pulls in around the ribs, collarbone, or neck with each breath, indicating significant effort. Third, pay attention to nostril flaring. Widened nostrils suggest they are trying to take in more air. Also, listen for sounds like wheezing, which is a high-pitched whistling, or grunting, a low moaning sound, both indicating difficulty moving air. If their lips or fingertips look bluish, that is an immediate emergency and means they are not getting enough oxygen. One insider tip that many medical professionals use is the respiratory rate measurement, which is simply counting the number of breaths per minute. For infants under 6 months, over 60 breaths a minute is concerning. For children between 6 months and 5 years, over 40 breaths a minute is a sign of trouble, and for those over 5 years old, more than 28 breaths a minute warrants attention. Remember, always consider your child's baseline behavior, as a change from their normal energy level or responsiveness can also be a vital indicator. By becoming familiar with these specific signs and understanding why they occur, you empower yourself to act confidently and promptly when your child needs you most. Your keen observation combined with recognizing these clear physical and auditory signals will help ensure your little one receives timely support, giving you peace of mind and promoting their healthy recovery.